believe this? Like 10 years later, and we're still dealing with this virus like this.
Do you remember when we were in nurse practitioner school back in 2020 and nobody could find toilet paper?
Yeah, and now it's food and meat.
I mean, here we are living off of the land. I mean, when is this ever going to end?
Good thing we can live off the land a little bit.
I know.
What's coronavirus anyway?
Coronavirus disease 19, or COVID-19, is a novel coronavirus that belongs to the Coronaviridae family and is responsible for the outbreak of recent severe acute respiratory syndrome infections originating in Wuhan, China. It was declared a pandemic by the World Health Organization on March 11, 2020.
Can I get coronavirus?
Most patients that are affected by COVID-19 are in the age group from 40 to 70 years old. The main host receptor for the virus is highly expressed in the adult nasal epithelial cells, so that's why adults are more prone to getting the virus rather than children.
What makes it better?
Treatment plans vary depending on the severity of symptoms from patient to patient. So most of the time, if you're not hospitalized, or if you're hospitalized but you don't require extra oxygen, there's no specific drug recommendation. It's just hydration. Sometimes they'll use steroids. They may put you on Zithromax, and it's just Tylenol, Motrin for fever. You would treat it basically like the flu. And then you have hospitalized patients who need extra oxygen, but they're not on a ventilator. These patients are usually receiving IV remdesivir, and in some cases also a steroid. And then you have patients that are very sick and on a ventilator, and those patients are getting IV remdesivir and steroids. The incubation period is 5 to 6 days, but it can be up to 14 days. During this incubation period, patients are asymptomatic. And so they've already contracted the virus, through aerosols or droplets, it's attached itself to the nasal epithelial cells, but they don't have any symptoms yet. Patients will initially present with signs and symptoms of fever, cough, body aches, sometimes GI symptoms, and that occurs when the virus has spread from what was once the asymptomatic phase until now it's spread further down into the upper respiratory tract. This usually lasts for a few days, and typically patients' immunity at this point is effective enough that it doesn't spread any further, but 1/5 of patients will progress to where it invades the lower respiratory tract, and at this point they invade the alveolar epithelial cells. And then they start replicating, and then it undergoes apoptosis. And then at that point, there's viral particles that are spread and they disperse to other cells in the lungs. And that's when patients can develop ARDS. SARS-CoV-2 might have originated from bats, and structural investigation of virus-infected cells reveal the coronavirus-specific morphology of SARS-CoV-2 and the size of the virus, which is between 70 and 90 nanometers. The most common signs and symptoms that can linger over time include fatigue, body aches, shortness of breath, cough, and chest pain. Other long-term signs and symptoms may include headaches, tachycardia, loss of smell or taste, concentration or sleep problems, rash, and hair loss. There are nasal swabs, nasopharyngeal swabs, and throat swabs. The most accurate swabs are nasopharyngeal, so those have become the standard for reliable testing.
When I first started nurse practitioner school was the same year that the pandemic hit, and I had the hardest time finding clinical sites and preceptors.
Did you even get any hands-on experience in school?
Not really. And now I just sit in front of a computer screen and treat patients through telemedicine.
Coronavirus!